Children younger than 5 are still waiting for their first shot of a COVID-19 vaccine, even as many adults are already getting their third. Here to answer your questions is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Always good to see you, Dr. Moffatt.
Great to see you too.
As you know, case numbers in the U.S. and here in Massachusetts, they're surging quickly. What's been the impact so far on the youngest kids, the ones who can't get vaccinated yet?
Well, children in general are making up about a quarter of COVID-19 cases right now. And data from Massachusetts, for example, don't yet indicate that children under 5 are making up a disproportionate number of those pediatric cases compared with other pediatric age groups. So it's not totally clear that their unvaccinated status yet is leading to more cases in those under the age of 5. But one thing is very clear. Infections right now are really ripping through households. And oftentimes, if the infection is brought into a household, everybody within that household is becoming infected, really sparing no one. So I think it's important for families to keep in mind that one of the things they can continue to do to protect everyone in the household, but especially those too young to be vaccinated, is to really take extra precautions when you're out in the community, including wearing masks when you're indoors.
Okay, well, Dr. Moffatt, so talking about the timeline for those shots for the youngest, Pfizer, Moderna, they're in the middle of clinical trials to develop the vaccine. We know Pfizer kind of hit a hiccup. The dosage didn't seem like it was effective. So what is taking so long? Do you have any updates?
Yeah, I don't have any updates beyond what has been described by Pfizer in press releases, basically. As you probably recall, as we move into younger age groups, finding the right dose, the one that is very safe and causes hopefully minimal reactions in children, but also very good immune response, is an added step of the trials in younger and younger children, and that takes time. As we did hear from Pfizer, in the 2 to 4-year-olds in their trial, that dose, the 2-dose series, which again was 1/3 of the dose authorized for those 5 and older, did not elicit immune response that were high enough to be expected to be protected. So they do have to take the time to look at a 3rd dose and see if that's going to get them where they need to be. And all of that really takes time.
Okay. Dr. Moffatt, I want to ask you some of the questions that we're getting from parents. This one is from Hung. Here's what he had to say. Quote, my 15-year-old got 2 shots of Pfizer. Does he need a booster shot, and when can he get one?
Yeah, it's a great question. Unfortunately, though, boosters are not yet authorized for those 12 to 15. And the reason for that is because there aren't data yet that suggest that immunity from the original 2-dose series is waning in the 12 to 15-year-olds, but those data are actively being collected. And I think it's very clear that if there are data that suggest that immunity is waning in that age group, or if we start to see signals that 12 to 15-year-olds are experiencing higher rates of severe infection from COVID-19, even if they're vaccinated, either of those would probably tip us towards starting to hear a lot more about boosters in that age group.
And one more question for you, Dr. Moffatt, this one from Meredith, and she asks, what's the risk of getting Omicron outdoors? Should we mask our kids at playgrounds?
Yeah, it's another good question, but if we think about what we're seeing with surges right now, whether they be Delta or what largely are probably Omicron surges, it's really happening from indoor spread. We do not have any evidence yet that Omicron is more capable of transmission outdoors. And the current CDC guidance still very much reflects this, with the recommendation for masking when one heads indoors. But there's no indication yet that we need to return to masking outdoors, and that there's anything specific about Omicron that would think we need to do that.
All right, Dr. Kristen Moffatt, we always appreciate your insight. Thank you so much for your time.
Sure. Good to see you.
Thanks.